All right. So hi, everybody. I'm Chris Carrubba, medical director over at TrueLearn. And with me today, we have one of our authors, Lindsay. And the two of us are going to show you guys how to go through a challenging question for the USMLE Step 2 and shelf examinations. Lindsay, you want to say hi really quick?
Yes. Hey, everyone. My name is Lindsay. I'm a fourth-year medical student at LECOM in Bradenton, and I'm super excited to get started.
All right. Well, thanks for being with us here today, Lindsay. So the purpose of this is not only to show you guys a little bit of, good medical information that can help you answer some questions right on the test, but more importantly, to show you some good test taking skills and how you can take your question breakdowns from, more of a beginner level to expert level, developing those test taking skills that are really going to help you get questions right and perform at a high level for the test. So what you're going to see as we go through this is a bit of a, teacher-student role with Lindsay kind of stepping in and, not to have any bad flashbacks here, but going back to that step 2 process. So, what we're going to see is, me giving her a little bit of guidance, asking her some questions on, how she's thinking through this and, wrapping it up together at the end. So one thing that I've just noticed through the years, both of, writing content, tutoring students one-on-one, is I think that a lot of people struggle because they're very passive in their test taking. And to me, that means they start off at the beginning of a question, read to the end, look at the answer choices, and only then do they start thinking about what matters, what could be the correct answer. I think a better process is to be a lot more active and start off by looking at the answer choices, thinking about the direction of the question. And then as you go through at the beginning, line by line, you're going to be able to think about, okay, what detail does this sentence support? What answer does this go with? What answer might this sentence rule out? So Lindsay, starting with you here, looking at the end of this question that's on the screen, you're seeing that it's a diagnosis question. What are your first thoughts when you see these answer choices? What connection do you maybe see with them?
So looking at the answer choices right here, it's all joint related, right? So I'm going to be wanting to hear if what history, really focus on that, seeing their physical examination, but really trying to narrow in and focus on the joints and anything that could rule in or out one of these diagnoses.
Right, absolutely. So you're looking for that common denominator, and then even taking it a step further, you think about, how many joints are going to be affected? Is it one or multiple? Are there systemic features with that? Could there be joint tap information, relevant there? Those are going to be some of the details that I know can help me separate out these conditions. So students doing this as well, you guys can feel free to pause, read through the question on your own if you'd like before, going any further, but we're going to jump in now and, take a look at this. So Lindsay, I'm going to let you read out loud, and then I'll step in and cut you off if need be and ask you any, questions that are coming up.
Okay, perfect. And I really think that this approach is just so great because being very recently past the step 2 era, it's not just content knowledge, it's really the combination of having the content but knowing how to answer the question. So I'll also to kind of interject with some of what I would be thinking as the student and see if that's also too in line, Dr. Carrubba, with what you would kind of guide me towards. So starting off, a 17-year-old boy, so thinking pediatric patient, but a little bit closer to adult, comes to the office due to several days of knee swelling and stiffness. Okay, so left knee swelling and stiffness. He is on the track team and has missed practice the past 2 days, but cannot recall any recent injury to his knee. The patient does not have fever or chills, so that's going to be really important because just remembering when I look down to the answer choices, some of them would have had more constitutional symptoms with it. He has no chronic medical conditions and does not take any medications. He lives in Vermont, so that's going to be important, Northeast, regularly goes hiking and camping with his friends and parents. The patient smokes marijuana and drinks alcohol socially. He is sexually active, so that's going to open up some of the answer choices as well with his girlfriend.
Let's pause for a second. You talked a little bit about kind of opening the door to answer choices. Based on risk factors, what answer choices right now would you think are open? And maybe, or just based on the details overall, what answer choices seem a little bit more closed at this point? This is usually where I like to stop in my mind before I move into kind of the exam findings, any other details, and think about, where am I at so far? So I guess my first question for you would be, what answers feel open right now?
Okay, so Vermont, I'm immediately going to be thinking Lyme. So that's going to rule in that just geographically, especially the fact that he goes hiking and camping. So he's going to be potentially exposed to tick-borne illnesses being in that environment. And then the sexually active, that's going to open the door potentially to any sexually transmitted diseases or associated infections. It does say with his girlfriend, but it still opens the door. So that could be the disseminated gonococcal infection or even potentially reactive arthritis as well.
And what's the tie-in for reactive arthritis? Why are we saying that one's open?
So that can typically form after a genitourinary infection, specifically chlamydia comes to mind for that one.
Absolutely. And so one thing I like to point out on this right away is you're also seeing something I see students struggle with is that sometimes they feel like, the correct answer has to tie to the risk factor. And you see here, well, it can't tie to everyone, right? It could potentially tie to one, the other, maybe neither. And that's how I know it. So I've always told students to think about it as, I wouldn't pick reactive arthritis just because the patient's sexually active. In my mind, instead, I'm saying it's opened the door to it. It could be possible. I have that information there, but it's not necessarily going to have to be it. And it really shouldn't be the only reason. If I can look at the stem and say nothing else fits, that's fine. I'm okay with that, risk factor being there. Plenty of sexually active people have knee pain for some other reason than reactive arthritis. Plenty of people from Vermont have knee pain for some other reason than Lyme disease. One more thing here, about the patient's age in there, does that help you, rule in or maybe rule out or, at least make any answer choices less likely or more likely?
Yeah, so with answer choice E, transient synovitis, I think that is going to typically be in peds, but a little bit younger as opposed to like a 17-year-old. Like I would think like 6 through 9, probably age range.
Absolutely. So, right off the bat, there's one kind of red flag in there for me on that answer. And then another one would just be that there's no mention of the preceding viral infection that you usually see. So is it completely closed? No, but you already have 2 red flags. And, again, for step 2 shelf exams, they tend to test fairly straightforward bread and butter presentations of diseases. So when you start stacking red flags and, atypical things, it becomes a lot less likely for that answer for me. You're not going to get a question where there's 5 atypical features for the correct answer choice. So, all right, I'll stop interrupting and let you move back forward.
No, that's great to keep in mind. Okay, so picking up with his temperature, so 97.8 degrees Fahrenheit, pulse is 79 per minute, blood pressure is 110/70, and his BMI is 22. So overall, vital signs look good. He seems to be healthy and within normal limits for those. The patient appears comfortable. That's also going to be important because some of these I think would be more ill-appearing than others. He has no skin rashes or lymphadenopathy. His abdomen is soft, non-tender, without hepatosplenomegaly. He can bear weight on both of his legs, and his gait is normal. So bearing weight on the legs and, being able to be mobile is important. The left knee has minimal tenderness to palpation, but a large effusion and palpable warmth are present. So that's interesting that it's minimal tenderness, but such a large effusion and the warmth, of course. There's decreased flexion of the knee secondary to swelling, but range of motion is otherwise normal. All of his other joints are normal. So I think I'll
take another time out here. This would be just kind of another stopping point for me. If you can't tell, I kind of like stopping at chunks when I'm thinking. Doing it sentence by sentence is probably a little too slow. Getting too far along, makes it more likely that I'm going to forget something. So in terms of details here, some things that are jumping out to me. What do you make of the patient's temperature? Does that help, rule out any answers?
Yeah, so I think that with disseminated gonococcal infection, he would have more constitutional, potentially a fever with that.
Absolutely. So to me, that's a big red flag that I'm not seeing there. You brought up there's, no rashes, no lymphadenopathy, no hepatosplenomegaly. Are there any answer choices that seems to be kind of helping cross out?
Yeah, so the juvenile idiopathic arthritis, that one, I think one of the big buzzwords I see is the salmon colored rash. So he has no presence of rash. It's only affecting one of the joints. It's not polyarticular. I know there's 3 different categories, but thinking about that, and no fever as well for him.
Absolutely. So really lacking a lot of the systemic stuff that I'd need to see if this was going to be the systemic form of JIA, because that's really the only one where you could just get that single joint involvement. And even that's a little atypical for the USMLE, at least at step 2 shelf exams. I'm having a hard time thinking about a JIA question where it was just one joint involved, even though that, technically is possible. And the other big thing you brought up was kind of the minimal tenderness to palpation, which again, to me, is something that really goes against DGI in this question. I'd expect a lot more tenderness there. Last 2 things that I'd point out at this point. So thinking about reactive arthritis, does the fact that this is just his left knee, does that make that more or less likely?
I think less likely, because is that one also polyarticular?
Correct. So I would expect kind of more of that asymmetric oligoarthritis picture in terms of reactive arthritis. So even though that sexual history is there, you would be giving me a really atypical form of reactive arthritis for this to be just one joint. And then if you're thinking about it too, that little mnemonic from step 1, can't
See, can't pee, can't climb a tree.
There you go. Are you seeing any of that other stuff there? There's not the urethritis. There's not the uveitis. So again, you're stacking up a lot of atypical things there that, it really would have me at the point where I would say, okay, yeah, the sexual history that is there, but I don't like that, this is only one joint. I don't like that this is, not having the urethritis and the uveitis with there. Same thing for the DGI. Yeah, the sexual history is there. I don't like that he's afebrile. I don't like that, the joint isn't very tender there. And then, last one here, for transient synovitis, we've already said there's kind of 2 red flags there. Someone with transient synovitis might have knee pain, but what joint's usually affected?
The hip joint.
Right. So the fact that this is a big effusion in the knee is just another, red flag atypical feature for me. Whereas, at this point, I would say we don't have anything that's told us this can't be Lyme disease. So, all right, I'll let you finish off the last details here.
Perfect. So then complete blood count and serum chemistry are within normal limits, and plain X-ray of the knee is unremarkable. Aspiration of the left knee yields yellow translucent fluid with a leukocyte count of 17,500 and 52% were neutrophils. No organisms are seen on gram stain. Which of the following is the most likely diagnosis?
Yeah. And so thinking about that synovial count, for a lot of labs on USMLE, I think you can get by just saying that something is low, normal, or high. Most of the time when you look at a hemoglobin, it doesn't really matter if it's 7, 8, 9, you can just say it's low. Same thing, goes for platelets, whatever. I do think the leukocyte count and synovial fluid matters. I think there are a little bit more where the number and the degree of elevation certainly can help rule an answer choice in and out. For an example, with DGI or, maybe a septic arthritis due to staph, you're going to see a much higher leukocyte count in there. With DGI, it's usually over 25,000. For septic arthritis, it's usually over 50,000. So that is one area where I certainly encourage students to pay attention to that. With Lyme arthritis, it's usually something in between 10 and 25,000 for the white count there. That certainly fits, with the number that we're looking at here. And then even the diff on that matters where, with DGI, it's usually going to be very neutrophil predominant. You'd see the same thing with a septic arthritis, picture from like staph, whereas again, the non-neutrophil predominance really fits more, with what we're, seeing with Lyme. At this point, what I would always tell students to do too is like, even if you feel pretty good about the answer choice or you think you're leaning towards it, I tend to still tell them to go through and do a passive process of elimination to say for each answer choice, maybe why they're not picking it. So for DGI, what would make you say, and I know we're kind of, covering back on a few things here, but what would make you say that disseminated gonococcal infection is, wrong if you're not going to pick that?
Yeah, so a few things that we discussed. So I think that with this one, much more pain would be involved. It wouldn't just be the swelling and the stiffness. I think it would be very tender on exam. The neutrophil predominance, like you had mentioned, it's just not where it really needs to be for that. And then for that one as well, no fever, no constitutional symptoms or anything like that.
Right. So for Lyme, I think we've never in there did we talk about something that makes Lyme wrong. We know they have the endemic risk factor. We know that Lyme arthritis tends to be a lot of swelling and stiffness, but pretty minimal pain. They don't tend to have the systemic features. The synovial count that we're looking at does line up with that. And then, for anyone thinking, this is, really atypical, remember about 30 to 33% of cases of Lyme disease have an initial presentation of this Lyme monoarticular arthritis. So this is not atypical. A lot of people don't notice the rash, and a lot of people with the rash don't have systemic symptoms. So it's very common for someone with Lyme disease to have that initial presentation be more of this early disseminated picture. So to me, that is not atypical. That lines up with, normal epidemiology. And, again, about a third of people are, could present like this. So nothing really to say Lyme is wrong, a lot of stuff that says it's right, but I would still want to go through my others and just make sure I know, why I'm not picking them. So, what about JIA? Why did we kind of say that was wrong?
Yeah, so with that one, so there are the three different types. We were kind of thinking more of the systemic one because it was monoarticular. But with that being said, he doesn't have the systemic features. He doesn't have a fever, and he also doesn't have that salmon-colored rash that you see often with that systemic version of it.
Yep. Reactive arthritis, I would say, again, the sexual history opened the door to it, but everything else closed it. They're giving me a single joint involvement instead of this asymmetric oligoarthritis picture. I'm not getting urethritis. I'm not getting uveitis conjunctivitis. It doesn't work. And then for transient synovitis, what would push you away from that?
So age range, it's normally going to be in a younger patient, typically in the hip, like we discussed. And there's not going to be like a joint to really tap with this. It's not going to have such an abundance of fluid in a joint. And if if the patient does have knee pain, it's probably going to be referred from the hip as opposed to originating in the knee.
And one other thing that I like to point out, especially I'll bring this up when I'm, tutoring somebody, you got to think with these transient synovitis questions, the effusion is usually so small that they don't tap it. So I cannot recall seeing a transient synovitis as the answer question where they gave me synovial fluid details, because it's just unlikely that they would actually tap that. So that's another thing where, I tell people, pay attention to questions and you start to notice hey, if this detail is in there, it's probably not going to be this answer, or maybe it is going to be this answer. So that's something else that jumps out to me as well there. Absolutely. So this does end up being a Lyme arthritis question. And it is a challenging question. That's why, I picked to have us do this one today, but I think it shows a lot of good test taking skills. And, from your perspective, since you did this more recently than me, just in terms of taking the test, how do you think, do you think thinking like this helps you? I know it might feel a little slow at first when you're, practicing doing it, but at least I always thought that when I really got into the test, it made me a lot more efficient. It kept me from making, mistakes.
Yeah, I feel the same way. And I think that part of, the dedicated study period is not only reviewing the material that you've been covering from your shelf exams, but it really is learning how to take the test. And when you break it down like this, you can really understand what the test question writers are looking for. And every sentence is going to be intentional. So they're not just throwing something in just to throw it in. It has a purpose when it comes to the vignette. And I think that this question too, I definitely would have gotten a little tripped up on this during my own step 2 preparation. And I think, though, that this is a great example to really show about trying to transition from just remembering buzzwords to really understanding the pathophysiology, because I know myself and a lot of other students, when they think Lyme, they think like that bullseye rash, and like that's obviously not present here. He does have like the geographic correlation to it, but I would have been like, well, he doesn't have that rash. So it's really good to work through it, understand the stages of disease presentation with this, and ultimately helping me arrive to the decision.
Two things I always tell students on, like just maybe some tricks that you might see. One, like if they tell me in the STEM, they don't recall a tick bite, I don't care. Lots of people that have Lyme disease and tick-borne diseases don't recall a tick bite. That never would rule it out for me. And then like we've said a few times here, just remember that a lot of people don't notice the rash, right? Like there's lots of parts of your body where you just wouldn't notice that. And again, it's less than 50% of people that have those systemic features. And even if they're there, they might be so mild that they just don't register to somebody in real life. Oh, I kind of had the flu or whatever. And, they're not really thinking about that when they come to the doctor a month later with this acute issue. So I think it's very fair that you could see that. And then, something I would tell people to take away kind of as we're wrapping up is just try to think like this too when you're reviewing a question. If you miss something, think about what detail made you get it wrong. Did you get tunnel vision the second you saw sexually active and decided that it had to be, DGI or reactive arthritis? Did you get really hung up on, the leukocyte count? So, trying to think that way and just get a feel for, where did I go wrong in this question? Where did I make a mistake? What was I supposed to pick up on? And go from there. Because I always tell people it's always better to be missing a question now than on the real test, especially if you have the open mind of, not only how do I learn this knowledge point, but how do I change my test taking skills? So that's kind of my 2 cents.
Definitely. And having just lived through it, I can agree to all of that.
All right. Well, thank you for your time today. And I hope this was helpful for everybody, and be on the lookout for more of these videos.
Take care.